Okay, pain management strategies. This is absolutely crucial for you to get better quicker. A lot of people don't understand how to treat their pain. They think it's okay just to push through it. So they keep on running, or they walk for a while and have pain initially, and then the pain goes away, and they think that's okay. All right? And this is the thing that prolongs the healing process. So when it comes down to taking the stresses off your foot, when it comes down to avoiding the pain, we have to avoid it really at all costs. Okay? The more that you put load down through that foot, the more that you cause pain, the more, like I said, it prolongs the healing process, it prolongs the inflammatory process if it's there, as we talked about in the last video. It may or may not be there, or it's just simply that you're stressing tissue that's weakened and deconditioned. We have to give it time to heal. Okay? If you push through pain, it's like a hammer that pounds on that area. If you keep on pounding on it, it just can't heal. It just continues to become bruised and irritated. Okay? So in the morning, first thing, shoes on with your prefab orthotic or your orthotic that you've had made by somebody. No slippers, no barefoot walking. You want to unload it as much as you possibly can. When it comes down to, actually I'm going to show you how to use a crutch here in a second, but sometimes just changing how you strike your foot can take the pressure off the heel. So if you're a hard heel striker and you hit that heel like this, it puts a lot more undue stress on the foot. So let's think about taking a shorter stride, and when you walk, and as you swing through, try to keep that foot down so you hit more the middle part of your foot. So as you're walking, instead of doing this and this, you're doing more this and this. So like I said, you're taking a shorter stride and you're hitting more your midfoot as you do this. You want to avoid exercise like treadmill, going for walks, doing any sort of extended standing sorts of things, because that just continues to overload the tissue, right? And things just continue to perpetuate as far as the pain goes. Most of our patients, when they come hobbling in here, they walk out with a crutch. Okay? How do you use a crutch? Typically, if it's just a one-sided problem, just one crutch. You get them at a pharmacy, CVS, Walgreens, whatever. When you stand with this and you put your arm down by your side, the gripping part should be at about your wrist. All right? When I put my hand onto it, there's about 3 finger breadths between my armpit and the top of the crutch. So when I walk, you want to pretend like this crutch is connected to the affected side. Okay, so I've got plantar fasciitis in my left foot. I've got the crutch in my right hand. When I go to walk, I move that crutch at the same time as my foot. I'm not going to strike my heel. I'm going to strike more my midfoot. So I'm striking here, putting as much weight as I have to on this to take the pressure off of this one. Okay, to avoid any pain. You can unload that foot up to 75% with one crutch, and that's a big thing for you. Okay, so you're stepping forward and then through with the opposite side. Connected and step through with the opposite side. Connected, step through with the opposite side. You can see I can go at a pretty good clip, doing this. Okay, so all the way through, I'm unloading it. I'm not bending and doing all this crazy stuff. The crutch on the opposite side helps to keep me upright. Helps me to take the pressure off that area. Okay. I've given you a complete list in a Word document on the video regarding your pain management strategies, and it lists several things that are on here. Basics being icing 2 to 3 times a day. Anti-inflammatories from your doctor, Advil, Motrin, 2 to 3 times a day for the first 7 to 10 days until you calm this down in combination with changing your gait, using the crutch, okay? Resting it, staying away from exercise. Biking, swimming in the meantime is great as long as it doesn't cause any pain. Okay? Night splints at night might be a good option for you. This is a dorsal night splint. Much more comfortable. You can just hold your foot up in a position so at night if you sleep your foot's down like this. So this tissue becomes slackened. So the first step in the morning, which is very typical of plantar fasciitis, to be really painful is much reduced because it's been held like this all night long. Okay? So it'd be attached like this. Okay, the Strasbourg sock is another example. Same sort of thing. People ask me, Chris, what can I do to get this better now? All this stuff in combination, pick up a dorsal night splint, pick up a Strasbourg sock to speed up the process. If you got any toe issues, the Strasbourg sock is not a good idea because it bends your toe at night. Okay. If you've got a running shoe store around you, get a running or a walking analysis done. Great way to kind of get things started. Running shoes are the best shoes for your feet. They give you the most shock absorption and the most motion control if you need it. I'm not going to have the luxury of seeing your mechanics to tell you exactly what to get or to tell you this is how your foot structure is, this is the right shoe for you. You've got to go and have somebody watch you and analyze you. Let's see, as far as any other things on my list here, we're going to talk about several other things for self-treatment, and I think that's it. Biggest thing is to respect your tolerance for weight bearing. Don't overdo it. Don't push through pain. This is not something that'll get better by pushing through it. It's not the no pain, no gain thing. You have to calm down, unload it, and give it time to heal. Okay, good. Thanks.